got a lively crowd tonight. This is awesome. Super excited. And I am going to bring on right now Miss Dr. Sheri. How are you doing, girl?
I am fabulous, April. How are you?
I am awesome. And I love your shirt. And you know what's funny is I actually put on like a pink tank that was similar to what you look like right now. And I'm like, I should have just gone for it, man, because we would have matched like big time. It's the perfect color of pink, too. It's not that kind of pastel, it's that vibrant pink, man. You're looking good.
Yeah, like we represent.
That's right. That's right. Well, I want to take a second to introduce everyone to you. You mentioned earlier we are talking about what kind of doctor you are. Why don't you tell everybody here what kind you are?
I'm an occupational and environmental medicine doc. So basically, that means I do workers' comp, I do specialized physical exams, take care of work injuries, but then I also take care of environmental issues if you got exposed at home using some type of chemical. So I get to wear a number of different hats. Anything you hear with CDC, OSHA, DOD, all of those types of acronyms, I'm that doctor that works with those kind of folks.
Wow, that sounds like a really interesting job. I bet we could have a whole nother segment just chatting about that and how COVID has affected you and just everything. I bet like I'm so like want to get into that, but I'm not gonna because we have so much ground to cover in a short amount of time with someone like you. I mean, this is such an honor to have you on the show today. You're just multifaceted. You're a doctor, you do speaking engagements, you wrote a book, you started a nonprofit. I want to touch a little bit on everything, but let's start where we always do with our breast cancer survivors and tell us the story about how you found out you had breast cancer.
Oh my goodness. Well, I was actually at home performing my monthly physical exam of my breast, like I have done since I was 20. And I'm standing there in the bathroom and I'm performing my self breast exam, and whoa, I found a mass. And I promise you, the moment that I felt it, I knew that it was cancer. Not because I'm a pessimistic person, not because I'm not a great outlook type of person, but because I know my body. And mentally, that connection was made. And fortunately for me, I had been on this breast cancer journey with two very dear friends of mine and had just handed the baton with the second one, was letting her fly free. She had my assistance all the way. And then lo and behold, I was the one now in need. But what that meant was I had access to the best breast surgeons, to all of the plastic surgeons, to the med-oncs, to the rad-oncs, because I had been on all of the appointments with these two individuals. So I had my lineup set. So as soon as I found the mass, I called the breast surgeon at home at 9 p.m. at night.
Wow, that's some good access right there. Wow.
I'm telling you, I'm telling you. So October 1st, 2008, that was when everything changed for me.
Wow. I want to talk a little bit here in a second about what it's like being diagnosed in Breast Cancer Awareness Month, because I too was diagnosed in Breast Cancer Awareness Month. But first, I want to say it's so important what you just said about that you knew your body, that you instinctively knew that you had cancer, and it's so important to be in tune with yourself like that. We actually have a volunteer who is a breast cancer survivor, Jennifer, and she was kind of the same way. She knew something was up, and she just kept driving it home until they figured out that that's what it was. So it's so important to know your body, know your risk, and really pay attention to your health. But you said you were diagnosed October the 1st. I guess at that point, Breast Cancer Awareness Month hadn't kicked off that much just yet, but wasn't that kind of surreal for you?
It was. It blew me away because I had my baseline mammogram just that February and it was negative. And I was actually in the process of caring for my mom. She was terminally ill at that time. And actually, I was on the phone with her when the ambulance dropped her off to what would be her last stay in inpatient hospice. We needed to make some adjustments with her medications. And I was done playing doctor. I'm like, I need to be in daughter mode right now. So let another doctor take care of your medications. And so she had just called me to let me know she had made it to inpatient hospice and was asking if I was going to come and visit that evening or whether or not I was going to wait until the next morning. And so needless to say, I waited because my whole brain just kind of went into this whole brain fart. Like, I cannot believe I have given this diagnosis so many times over then that 15-year history of being a physician. And now all of a sudden, I knew that I was the one that was going to hear that diagnosis. And I actually got the call from our breast surgeon October 13th with the results of the biopsy, and that proved to be invasive ductal carcinoma. So October 22nd, I was on the OR table having surgery.
Wow. So you did actually get the diagnosis. You found it October 1st, and then you got the diagnosis mid-October. And so you were in the deepness of breast cancer awareness month, where you're just surrounded. And it's like, if you wanted to forget, you might as well just forget it. You're gonna know about breast cancer because it's all around you at that time. Which, I mean, I love the point of breast cancer awareness month, but at that point in time, I was like, can somebody turn down the volume on this a little bit? You know, it was a little bit much. So you had the operation. You had your surgery just 7 days. Is that right? After your diagnosis, the 13th you were diagnosed, and
well, 9 days after the diagnosis.
22nd.
Yes.
Okay.
Yep.
Got you.
Yep.
Wow.
9 days after.
It's killing me that all your dates. I was diagnosed on October 26th. So we're just like right around that. But I was in 2010. In what year did you say you were diagnosed again?
2008.
2008. So you got a couple years on me right now.
Yes.
So
yes. But by the time you were diagnosed, I was facing another diagnosis as a result of my breast cancer treatment.
Yeah. Well, tell everybody. Yeah, I want to get to that. But tell us what kind of surgery you had, and then what kind of treatment you had, and then take us from there, man. I'm ready to go on the ride. I'll be in the background surfing on that ocean, listening to the whole story. I just love the way you look there. It looks so good. All right, give it to him.
Well, you know, my breast surgeon had planned in her mind, this was a small mass. So we were going to have a lumpectomy, maybe have some few rounds of radiation. This was going to be easy peasy, get in and get out. But that never really settled in my spirit and deep within my inner being and in my mind that it was going to be that simple. I pretty much set myself up that this is going to be a little bit more tedious than what she was expecting. And needless to say, when she got in, I ended up with a partial mastectomy. She had to go in 4 times in order to get clean margins, because that was my one stipulation. You do not go in and just cut out what you think to be all. I wanted live pathology done at the time when I'm under surgery. So if you need to keep me out for 4 hours to get it all clean and all out, then do your due. So it was a partial mastectomy. She ended up removing half of my right breast, and she did what's called a level 1 lymph node dissection. And she removed 16 lymph nodes, 3 of which were positive for breast cancer. So what turned out to be a small lesion when you first felt it was actually growing directly back towards my lung. And so had we not found it when we did, I would not have lived to see the summer of 2009.
That's terrifying. Terrifying. And so, yeah. And so when finding the additional cancer in some of your lymph nodes, what did they finally stage you at?
Stage 2A, invasive ductal carcinoma.
Yeah.
And I remember waking up, seeing her at when I was in my hospital bed, and it was about 10 o'clock at night when she finally came to round, and she was totally speechless. She could not even talk, just tears rolled down her eyes. And I and Barbara, again, remember I had been with her with a couple of other patients, right? And so we had developed this relationship, and she saw how attentive and the care I'd given to my other friends and colleagues. And then now that it was me and having pumped me up, she felt like she had pumped me up just to have to come into my room to give me the letdown. But what I had to tell her was, I never accepted your pumped upness. I knew what I was doing.
You were falling for that.
You may have been disappointed,
right?
I wasn't. What I found, when by the time she came to the room, people had told me, my family had told me that the lymph nodes were positive. That was confirmation for me. So I told her, you don't even have to say a word. I have my confirmation. We'll deal with this in the morning. I'm just letting you know now you'll need to place support. Literally, that was the extent of our conversation that first night of surgery. And she went on her way, but I ended up with 15 rounds of chemotherapy and 33 treatments of radiation.
Wow, that's crazy. You know, every time I talk to a survivor who has chemo and radiation and surgery, I'm just like, man, you got the whole gamut. I mean, for me, I had surgery and I had chemo, so I never experienced radiation. Do you recall what type of chemo you had? Was it the adriamycin, Cytoxan, Taxol, the standard care?
Yes. Yep.
Gotcha. And so some of the people watching, we don't really get in too much into what radiation is like. I know from seeing some of the things that my friends have posted, it's pretty scary. Tell us a little bit about what that experience is like.
Radiation is like one of the consistent symptoms that everyone would share about radiation was that, oh my God, you're going to be so tired. There'll come a time during the day you'll hit a wall and you just can't do anything anymore. And for me, I'm thinking, oh, well, yeah, I got enough energy. Maybe I'll hit that wall at 5, so I have to stop work 3 hours early, because normally by that time in my life I was working easily 12, 14-hour days. And so I just thought, oh, as bad as chemo was, radiation will be a breeze. No, it wasn't. It's, every day except for Saturdays and Sundays. So for me, that's, 33 days except for Saturdays and Sundays going in. And no, it doesn't last a long time. When you get on the table, you really think, oh, I'm not really feeling this. It's going to be okay. And I promise you, when you get home, everything that they said, hitting that wall, for me, it was 2 p.m. At 2 p.m., it's like my brain shut down. I couldn't think anymore. I couldn't do anything anymore. And I was just drained. The only thing I could think of doing is lying down. And whether that was on the sofa in my family room or in my bed, I had to lay down. But one of the things that other individuals didn't necessarily share so much is the radiation burn. Oh, mama, it's nothing like imagine if you were to burn yourself, let's say on an oven or a grill, and now you're burning yourself in your armpit or on your breast or around your nipple.
Somewhere very, very sensitive. Oh my goodness. And so it's really like a burn, like it's an actual burn. Yeah.
Yes. Yeah, your skin turns all kind of brownish, blackish, crazy colors. It's very painful to the touch.
Right.
It was not a pleasant experience at all.
Oh my goodness. Yeah,
Yeah.
that sounds horribly painful. And you're right, people don't really talk about it very much. It's sort of like the first part of our conversation. I had the surgery, I had chemo, I had radiation, and then you kind of just keep talking. You don't necessarily go into the details of it, and that's why I think it's important to share that. I know when I went through chemo, there were a lot of things that happened that I wasn't expecting, neuropathy and the skin of my feet peeling off and my fingernails changing color and just crazy stuff like that. Did they kind of tell you when you're going through radiation, like, hey, this is what's going to happen to your skin and this is what you need to watch for in case there's some kind of a problem?
The radiation oncologist and the nurse did explain that these were significant risk. I mean, it's a high probability that they're going to occur. But how bad the burn is and how well they respond to the subsequent treatment is different for each individual. And so they also shared that. And so when you're going into yet another treatment phase, I think what we do mentally is to try our best to hope that we're going to be in that easier class of individuals. And so that's where my mind went. Yes, obviously this is radiation. So obviously I'm susceptible to burn. But in my mind, I kept thinking, oh, I got enough tissue there, or, oh, it won't be so bad for me, or, oh, my pain tolerance is pretty high. Turned out being 100%.
It's like you really do learn what your pain tolerance is when you go through breast cancer. Oh my gosh, goodness gracious. I can't even imagine. I've seen, I'm in a lot of different breast cancer survivor groups on Facebook, and I'll see people post pictures of an area that they've had radiation and showing some of those burns and things like that. I'm just like, I never experienced that, so it's just foreign to me. And so it's really interesting to hear about that and learn about that. So how long was it from the point of being diagnosed on October the 13th to the point of finishing your surgery, your chemo, your radiation, and everything?
I was diagnosed October 13, 2008. I finished my last radiation treatment July 2nd, 2009. So it was about a 9-month process for me, close to 10 months.
And whenever I have something that ends up being a 9-month process, I'm like, it really was like having a baby, I'm just saying, it's crazy. So you mentioned earlier that from these treatments, you had kind of an unexpected thing happen. Why don't you tell everybody what happened next?
I did. Well, one of the complications that is kind of out there, it's more out there now, wasn't so much out there when I was first diagnosed. There was this thing about lymphedema, this thing that could occur if you've had lymph nodes removed and or if you had radiation to the area. It's a risk that it could occur. I remember my radiation oncologist telling me the risk was about 1 to 2%. 1 to 2%. Well, these stats that we were operating off of back then weren't real stats because people weren't really doing the research that needed to be done as far as lymphedema. But it's actually 1 in 3 cancer, at-risk cancer patients will develop lymphedema sometime throughout their lifetime, and 50% of them manifest within the first year. I was in that
Wow.
50% group. Yeah. So
Yeah.
lymphedema, your lymph nodes are part of your immune system. And so you have lymph nodes in your neck, under your armpit, in your groin area. They're all over your body, and they help to take care of micro trauma. Little things you do, carrying your purse, carrying your groceries, little things that would normally cause little minor swelling. Your lymph nodes come in and they take that swelling away. So you never really appreciate it unless maybe you took a long walk on the beach and you notice your rings are kind of tight or your ankles may be swollen. But once you go to bed, once you rest, you look up and you go, oh, okay, well, the swelling's gone away. Your lymph nodes are working. Well, between the cancer itself, because remember, 3 out of the 16 lymph nodes that were removed were positive for cancer, plus they removed 16, plus I had radiation, plus the chemo going through all your system. I was that 1 in 3. I was that one that got lymphedema, and it causes painful and at times debilitating chronic swelling in the affected limb. So for me, it affected my arm, my hand, and my fingers. A lot of times, people, it only affects their arm. But me, of course, it affected it all. I blung my stuff out because I figured if I got to wear it, I might as well try to look cute.
And you do. You're
So
doing
I
it.
have crystals all
That's
over the place.
awesome. Yeah.
But what it meant for me was wearing these compression garments, and or if I take them off, I'll have this big, huge arm. I can't perform the clinical functions of my job. So
Wow.
all of a sudden, 16 years after practicing, 1 year from my diagnosis, I had been treated. I'm done. So I finished radiation July 2nd, 2009. By August 2010, lymphedema had taken over. And I was relegated to 4 months of physical therapy every day. Only days I had off was Saturday and Sunday. I met with specialists trying to see if I was a candidate for some type of lymph node dissection and transplant surgeries, all types of new surgical techniques coming out for lymphedema. I wasn't eligible for any of them, which a lot of people aren't. There are over 5 million cancer survivors in the US now living with secondary lymphedema.
Oh my
And the
gosh.
majority of most of those individuals won't qualify to be able to have some form of surgery. They won't even be able to afford it, or their insurance won't even cover it. We can't even get insurance companies to cover compression garments,
Oh my
let
gosh.
alone all of these fancy spancy surgeries. And so lymphedema stole my career. I looked up, and after 16 years, I had to completely reinvent myself. After wanting to be a doctor since I was 2 years old, I had to find something else that I was good at, and something that would bring in some money because I had 2 teenage daughters that expected to eat every day. Every
It's
day.
like, what is that
Yeah, we
about?
skip
Come on.
like Monday, Wednesday, Friday.
Something, give me a break here.
Exactly.
Wow, that's
So,
so crazy. And
yeah.
so, we have a volunteer who's a breast cancer survivor. Her name is Paige, and I know that she is struggling with this, and I can't wait for her to watch this. I know she's working right now, and she's going to watch. She's a teacher, but I know she's going to watch this later, watch the replay. But she wears the compression garments and everything as well. What physically does the compression garment do that keeps the swelling down? Is it like, what does it actually do? Is it just a matter of just pressure and the swelling doesn't slip to somewhere else? I mean,
It's something like that. The compression garments, true compression garments, are designed in such a way, all of the little small microfibers that come together are designed to actually promote the lymph that has built up in your extremity to go and find another circuit where it can drain out of.
Gotcha.
And so there are people think that with lymphedema that you need a hard massage to get the fluid to move. You don't. Your lymphatics run right up under the skin layer. So it's really just a small, soft touch that really moves it. So the compression garment does two things. One, it's finding and teaching your body to find other open channels, if you will, to drain that lymphatic fluid. But it's also keeping, as you're moving around and lifting groceries and doing your hair, it's preventing more trauma, i.e., more swelling from developing. So it serves two purposes. But in addition to wearing the garments, you still have to do what's called manual lymphatic drainage. So that's a special type of massage that you do in the morning before you put on your garment to help keep the swelling down. And then you do that same, at least for me, and because of the severity that I have to do that massage again at night before I put on my nighttime garment. And my nighttime garment doesn't look as pretty as this.
It doesn't have
like
the bling.
really big, it looks like an oven mitt. All the way up to here, all the way
Oh
down
no.
here. And imagine an oven mitt just all the way up your arm.
And that
Kind of
just
difficult to be sexy.
yeah, well, but prevents it in the morning. Then it helps you for when you start your
Yes.
day, and then
Oh my
oh
goodness.
my gosh,
Yes. I
it's
wake
like a
up
full-time job, man.
full time, full time.
So
And
you
people
constantly
go
have to
ahead.
wear a compression garment like all the time? Are there ever like days you're just like, oh, well, it's not flared up today, or is it just something that's just there all the time?
Is there all the time.
Wow.
There are some days that are, I would say, that are better than others, meaning like once I take off my garment, my hand or arms look better. They're not as swollen. But there are environmental factors that contribute, whether or not it's very humid, is it really hot, is it really cold, and those types of things. Plus, I have the neuropathy, just like you've experienced as a result of the chemo, so that complicates it even further. But the lymphedema itself, brings on financial responsibilities because you need at least two compression garments at every single moment, because when you're washing one, it needs to air dry, so you need to be wearing another one. You got to buy new clothes because your clothes don't fit. It changes the types of clothes that you wear. It changes how you wear your hair. It changes if I go to a reception and they have cocktails and past hors d'oeuvres. Well, my hand doesn't work the way it should, so it's kind of hard trying to hold a cocktail. And I remember the first time I tried getting an hors d'oeuvre with the little
You're like
prongs,
little, yeah.
trying to
You're
do
just
my,
like
and man,
everywhere.
it's spread everywhere.
Oh
Oh
no.
my goodness. So
Oh
now I do
no.
the polite thing. Oh no, thank you.
I'm good.
I'm starving. It looks so
I know
good. I want
you're
it so
like,
bad. It's like,
but no,
thank
no, thank you. Can you just plop it right in my mouth?
Right.
Well, are you right-handed? Are you
I
right-handed?
am.
So that is
I
is it
am right-handed.
causes difficulty writing all the time and everything?
Writing,
Oh
typing. And
gosh.
I have to admit, there are times when I need to cheat, because if I'm taking notes, if I'm in a meeting and I
Right.
need to take notes, I can't. By the time I take notes with this glove on, I can't read what I've written.
Yeah.
So, I have to cheat and take it off and write my notes, and then that affects the swelling. And it's a pain in the butt.
Yeah.
Plus, the garment always reminds me of my cancer diagnosis.
Yeah, it's you
It
can't
is
but
a constant reminder.
yeah, and but the one thing about you, Dr. Shri, is that you have this just glowing positivity that you just bring. It's just like this huge light, and I'm so excited for people to see this. And I know people are going to watch the replay, and we have people watching right now. We're going to also post this on our YouTube channel and make sure that people are aware of all these details that you've shared, and that they're not alone, that there's someone else out there that's going through this. And in fact, you started a nonprofit as a result. And I know we're getting close on time, but you got to tell everybody about what you're doing with your nonprofit.
Okay, real quick. The Live Today Foundation is designed and was created for three purposes in mind. And out of my travels and what I see, have witnessed internationally as well as here in the US regarding lymphedema. One, we need to educate physicians and other practitioners on how to properly diagnose lymphedema and make them aware of the psychosocial impacts of lymphedema, all of that financial, the embarrassment, the constant reminders of your cancer diagnosis. Make them aware of that so that they can put patients in contact with the proper resources so that they can deal with these issues. Number two, making patients aware of the importance of treatment, that this is not just some swelling. This is a disease that needs to be treated, just like diabetes, just like high blood pressure. And then third, we provide free compression garments. Yes, you heard me right, free, Free compression garments to under-resourced cancer patients and or survivors living with lymphedema. And we have partnered with a company called ImpediMed that has created something that allows a clinical assessment tool that will allow your doctors to detect stage 0 and stage 1 lymphedema. You catch it in stage 0 and stage 1, easily prevent it. You wear compression garments for 4 weeks, boom, you don't have this chronic debilitating lymphedema like I had to live through. But unfortunately,
Wow.
most patients aren't aware that lymphedema, this chronic disabling lymphedema, is preventable, because by the time they see a doctor, it's already stage 2. By the
Yeah.
time it's stage 2, it's chronic. But you need to ask your doctor, do we have a device here at this institution that would allow me to detect early onset lymphedema so that I don't have to live with chronic debilitating lymphedema? You need to ask your doctors, because there are so many more institutions across this country and abroad that has this device that can prevent an individual from having to completely reinvent themselves like me, or have this extra financial burden on their life for the rest of their life, even after their breast cancer is considered cured. I'm 12 years out. People consider me cured. Well, I may be cured from breast cancer, but I'm certainly not cured from lymphedema. And
Right.
there's no reason now why breast cancer patients should have to fear this onset of chronic disabling lymphedema, now that we have access to a tool, a clinical assessment tool that can prevent it
That's
and catch it
amazing.
early.
That's
Yeah.
amazing. And you're telling stuff right now that I didn't know. And if I didn't know, I'm sure many people watching right now were completely unaware that if you catch this early, it's preventable. You can make it where it's not this life altering problem that you have to deal with. That's so important. Wow. And that just kind of takes us full circle back to the beginning where you were like, I knew my body, I took charge of my health, and it's all part of that, So I want to make sure, and I will get your website address and pop it in here so that we can let people know where to go to check that out and learn more about you in general. And we're like right up on the edge here. But I always ask every breast cancer survivor that I have on the show, and I think this will be easy for you since you have your nonprofit, but it might be something different. Tell everybody something positive, or one of the most positive things that you think that you got from going through breast cancer.
Going through breast cancer, the message that I have received for myself, and a message that I share to everyone who hears me, is that I want you to choose to live today and every day. And by live, I mean love yourself and others, inspire those around you, voice your dreams and ambitions, and enjoy life. Live today and every day.
I love that. Dr. Sheri, thank you so much for taking your time out of your day to be with us today. And I can't wait to share this video and this interview with the masses so that we can make sure everybody's aware of how to prevent lymphedema, and also just to learn your positive spirit and see that you can stay positive through a breast cancer diagnosis. And just amazing. And I want to have you on again because we have so many more things we could talk about, man. I would love to have you back again sometime. So thank you so much for taking your time out today, Dr. Sheri, and we hope to see you really, really soon, okay?
You got it, April. Thank you so much.
Take care. Everybody, that was Dr. Sheri, man. She is awesome. We're so pleased and blessed to have had her on the broadcast.